Debbie. Good morning. My name is Debbie Kim Morikawa, and I'm the owner of GYMGUYZ. We're an in-home personal training and mobile fitness franchise. I really want to thank Debbie and Navi in Hawaii for inviting me to be a presenter today. I'm going to be reviewing some fitness basics with you, as well as some things you should know and understand before beginning any type of exercise program. The foundational techniques I'm going to be talking about apply to exercise as well as any activity you might be doing throughout the day. I really want you to become more aware of your own posture and movement mechanics so you can begin the process of creating new and better postural habits. It's funny, whenever I start talking about posture, it never fails that people will start to sit up a little straighter. But sometimes, trying to sit up or stand up straighter, most of us don't really do much more than that to try to improve our posture. So my goal today is for everyone to understand the importance of good posture and mechanics to help you feel better, look better, and hopefully function better. Good posture is not just about aesthetics. Without it, your spine can start to shift. There's uneven pressure placed on your joints. And before you know it, you're experiencing both soft tissue changes as well as sometimes permanent damage to your joints. So we often think of athletes as people who are in great shape, right? But the reality is they put a lot of stresses and strains on their body that aren't really good for them. The exercises they do allow them to excel in their sport, but they can also cause permanent damage. And I'm not just referring to the higher risk because of the sports injuries. If you look at these pictures, you can see their bodies are often twisted in extreme positions, placing tremendous amount of stress on their joints and their spine. Many athletes suffer the consequences of having to train to perform these kind of movements at the expense of their bodies. But eventually the stresses and strains catch up to them. And when they get older, when it's too late, that's when they start to experience the pain, the dysfunction, and it's too late to reverse the damages. For most people, exercise should be about fitness. We want to train your bodies to function well so you can feel better. Not to get all doom and gloom on all of you, but if you don't pay attention to the alignment of your body and how your body is moving, just like the athletes, you may not feel anything right now, but as you get older, chronic back posture can make it harder for your muscles to take pressure off your joints, placing an abnormal amount of stress on your body. These stresses can increase the risk of developing or worsening osteoarthritis or degenerative joint disease. And whether it's a knee injury or in your spine, these changes can affect your ability to function and ultimately impair your mobility and independence. So many older adults complain of knee pain, right? When trying to stand or start leaning, when they're trying to stand or start leaning over, that's usually when they feel the pain in their knees. Or some people develop what we refer to as an excessive kyphosis. You see that rounding of their upper back or their thoracic spine. Oh, sorry. Moved ahead too fast. So one common problem that contributes to kyphosis is that forward head posture, or tech neck is what they call it right now. Your head weighs a little more than 10 pounds or slightly more than a bowling ball. Your neck has to support your head all day long, except when you're lying down. So good neck posture requires your head to rest directly above your neck. And in that position, there's no weight or stress. But as your head shifts forward, the weight of the head increases, placing more stress on your muscles and spine. So you can see it goes from 20 pounds to 40 pounds as your head starts to shift more and more forward. It's really unfortunate, but most of us actually do have a slightly forward head. There are very few people who have their heads directly over their shoulders the way it should be. So hopefully I've made a case for you that it's really important to look at our posture and try to remember that good posture needs to be a habit and not just something that you think about. Okay, so how do you make it a habit or an automatic response? The first step I always tell people is about awareness. You need to know what your own postural habits are. And if you have any of those asymmetries, you can't correct what you don't know is wrong. So, sorry. What kind of posture do you have? Very few people have that perfect posture, but the key is whether you know what your posture is. As I said before, if you can't recognize it, you can't correct it. So when I don't pay attention to my posture, I start to revert to bad habits. When I'm conscientious, I can start to feel when I'm starting to shift and go out of alignment. So even for me, I have to practice and be conscious of it constantly. Otherwise, we get into those bad habits because we've developed it over many, many years, a lifespan. So we're not going to change them overnight. So it's going to take a while for us to actually get used to and make it a habit for ourselves. So, there are things that we do on a regular basis that cause us to have that poor posture that we've developed over a lifespan. So working at a computer, reading, eating, and even driving. You know, you look at all these positions, you look at their heads, you can see how forward they're shifted. We probably aren't even conscious of most of what we do, but over time, sometimes those joints start to shift and you can develop permanent changes. So that's why it's important to identify those deviations you have from neutral before you start an exercise program, because if you aren't even aware that you're starting in a dysfunctional position, you could be reinforcing that asymmetry as you exercise, which is not what you want to be doing. Okay, so again, the first step is really recognizing when you're out of alignment. And what I tell people to do is get in front of a mirror. And the best time to do it is when, before you take a bath, where you can kind of see your whole body and you can kind of see what your alignment is. And what I'm going to do is I'm going to go through all of the different things that you should be looking for, and then try to give you an easy way to try to cue yourself. So in addition to correcting your alignment, you may also need to work on increasing your flexibility and strength to keep or maintain that good alignment, because your body may not be used to staying straight or being, aligned, and those muscles may need to be developed and strengthened. You may also have to increase your endurance because, again, you aren't used to holding those good postural positions. So those muscles are going to get tired and you're going to start to go back down again. So again, you want to practice, build up the endurance so that you can hold it for longer periods of time in the proper position. And the other thing is your spine is supposed to be stacked. So I'll show you these pictures later, but when everything is aligned, there is less stress on the muscles. So over time, it should get easier and easier. So what are the prerequisites for good posture? So to begin with, you need to be able to maintain the neutral curves in your spine. And what does that really mean? If you look at the skeleton on the left, that represents the ideal posture. Most of us have some asymmetry, but hopefully it's not too bad yet. What we don't want is that skeleton on the right, that's the imbalanced spine. And it just starts with one part of our body goes off, and then everything above it starts to compensate to try to keep our balance, to keep us in neutral. And that's where we start to develop all these deformities. So how do you get yourself into good alignment? First, you want to make sure that you're vertically stacked, where you can draw a straight line from your ears down to your shoulders, hips, ankles, and feet, toes, basically, just like the figure on the right side. So that's the stacked position. You want to make sure that your knees stay loose. Almost all of us tend to lock our knees. And we do this because by creating a physical lock in our knees, we don't have to expend any energy because the muscles aren't working. The risk of locking your knees is that if someone comes along and bumps you, you're kind of stuck in that position. So you're like this board when somebody hits you, you can't get out of it and you're just going to go over. So, if you have any kind of balance issue, definitely don't want to be locking your knees. The other disadvantage is that the physical lock disengages your muscles. So you may think, oh, I've been standing for a while, I've been working my muscles. Not if your knees are locked. Your muscles aren't working. So you want to make sure you get into the habit of whenever you're standing, make sure that you loosen your knees. So we always call it soft knees. So make sure your knees are soft. We also want to make sure that your shoulders and hips are level and parallel to the ground. So that's what you're kind of looking at the left side of the picture. And our body weight should be evenly distributed through those 3 points that you see, those blue dots. Let me see if I can. So get my little laser point. So you see these 3 dots here? There should be even amount of pressure on those 3 dots. And a lot of times what you're going to notice is that when you get into those positions where you're trying to put the weight, you're going to find that, oh, maybe it's not that way. You may be leaning one way or the other. So it could be that like this one, your weight is shifted to the outside of the foot On this one, it's shifted to the inside of the foot. And sometimes you can see that just in the wear of your shoes. You look at your shoes and your shoes get worn out unevenly. That's an indication that you're starting to shift your weight and it's not evenly being distributed through your feet. The bad thing about that too is that, you know, it starts to put a lot of stress on your ankle, so which again is going to make you more prone to injury and possibly also balance issues. You want to be right in that middle one where it's perpendicular to the ground. So even though we talked about the feet last, in reality, the positioning of the feet and ankle are the most important, as they're the foundation on which you stand. And if they're misaligned, you saw that imbalanced spine that goes up the chain, all of the joints above will be thrown off trying to compensate for that imbalance. So you need to pay attention to that weight distribution at the 3 points of the feet. And also think about what it feels like, you know, as you're shifting your weight to the inside and outside, how is your weight distributed? And I'm going to ask you to try it a little bit later. So actually, we can go, I don't know if you guys have a place to stand, but what I suggest is that you just stand up, get your feet shoulder distance apart, unlock your knees. It doesn't need to be bent, but just unlock your knees. And then, like I said, just kind of feel, see if you can feel that weight on those 3 portions of your toes. Then just start to lean forward and then lean backwards, just slowly lean from side to side and feel how that feels on you. So that's the way basically, you know, you want to try to find your balance. We see a lot of people, and I'm going to show you a video later that I took of me pretending that I lost my balance, but I actually did lose my balance. But basically, when you lose your balance, your body goes all over the place, right? So you need to be able to find that center, and having that sensation of how to shift your weight to find that center is really important. The other thing that's really important is making sure that you have enough ankle mobility. We often forget about that, but a lot of us don't have enough dorsiflexion, and that's the ability for that ankle to go up. So one of the tests for that is standing 2 inches away from the wall and seeing whether or not your knee can touch the wall. Excuse me. If you don't have enough, I'm sorry, just one second. If you don't have enough dorsiflexion, squatting down to pick something off the ground can be difficult. So the one good thing about the assessment that we use is it's also a good exercise. So if your knee doesn't easily go to the wall, it means you're lacking some dorsiflexion. And this is something you might want to do every day to get more stretch into your ankle. Okay, so next, let's look at shoulder alignment. All right, so these pictures look almost exactly the same, right? I mean, they look like they could have been the same picture, but there's actually slight differences to them. To know whether your shoulders are in neutral or too internally rotated, what you should do is stand in front of the mirror and look at the position of the hands. So you see where that yellow box is. The thumb is pretty much facing forward, and that's what an indication that you're standing in neutral. More commonly, though, you're going to see the hands in the red circles, where you see more of the backs of the hands. So if you're seeing kind of more of the backs of the hands and not as much of the thumb, that means our shoulders are rotating inward, like that forward shoulder, forward head that we were talking about before, and that can create a lot of problems for us. So you want to make sure that your thumbs are actually facing forward. But how do you do that? So the best way to do it is let your arms drop and face your palms forward with your thumbs pointing out to the side. So what that does is that externally rotates your shoulders out. Keep your shoulders down. So you don't want to be doing this. So make sure that your shoulders are down. I know I'm a really tiny picture in there, so you probably don't even see what I'm doing, but I'm not used to doing a webinar. I'm used to being in person. So it's like I'm talking and my hands are moving. But okay, so the easiest way, again, is just to rotate your arms out so that your thumbs are pointing out to the side. Keep your shoulders down and back. And then I want you to fix your shoulders there and then just relax your hands. And when you drop your hands, you're going to see your thumbs are now facing forward instead of you seeing more of the backs of your hands, where if your arms rotated in, you would see the backs of your hands. Okay, so this is a picture of me where I'm trying to show you scapular retraction. So whenever people have rounded shoulders, a lot of times people make a common mistake that they want to go into scapular retraction. They pull their shoulders back. So you've seen people do those seated rows and they pull their scapulas back and they're doing this and they're arching. That's like one of the worst things you can do. Because first of all, you can see that the rhomboids, which is what creates scapular retraction, aren't even attached to the arm. So how are you getting the arm to rotate out if it's not even attached to the arm? So what you want to be able to do is first, you want to be able to depress your shoulders. So you're going to push those shoulders down, just like, let me get my laser pointer again. So you're going to push these shoulders down first. So you can see the arrow is going down. And then you want to make sure that the bottom of the scapula is going down and in. So it's going in towards the spine, but it goes down before it goes in. And then you squeeze the bottom of the blades together. And that's where you start to open up your chest instead of just going back and squeezing. Because if you go back and squeeze, I guarantee you're going to develop muscle spasms. Those muscles are going to get tired. But this natural position actually puts your scapula flat on your back. It's your serratus anterior that's flattening it back on the back and helps you to keep your shoulder in a good position so that you can get good mobility if you go into shoulder flexion or anything that you're trying to do. Okay, so to review what we've just covered, you want to be in that stacked neutral position. You want to start with the positioning of the feet. You don't want them too close together. So, about hip distance or shoulder distance apart. You want to look at your feet and make sure that your feet are even. So it doesn't mean that they have to be parallel, but you don't want one foot like going out and one foot going in. You want to try to keep your feet kind of symmetrical when you're standing, especially if you're going to be standing for a long time, like whether you're standing in line or waiting. And the reason for that is because anytime you're in one position for a prolonged period of time, you start to stretch out those ligaments and even the muscles. And then the other side gets a little bit shorter. And that's when, again, you start to create those asymmetries. So whenever you're going to be in a position for a longer period of time, try to be symmetrical. So you want to start with the feet. You want to get into that three-prong, the tripod position, even weight on all of those three pads. You go up to the ankles. You want to make sure that, again, that those ankles are stacked, the knees are loose, the hips and the shoulders are level, that one's not higher than the other. And when you're going for that, you're wanting to make sure, so we started at the feet with that three-point stance. Sorry, I got ahead of myself. See, I'm used to just talking. Okay, so yeah, so you want to go start with that three-point stance. And then again, for the shoulders, if their shoulder is higher, a lot of times what people want to do is they want to raise the other shoulder up. No, you want to push the shoulder that's high down. And that's how you want to level out. And sometimes when your hips, maybe one is higher than the other, you may not notice it until you actually really look. Sometimes it's not just up, it's because your hips are actually slightly rotated. So you might want to actually kind of rotate yourself and see if that levels you off a little. Okay, I want to show you this picture because this is, remember we talked about getting on those 3 points of your feet? So what I did was, I got this from this one video where they said, if you put all that weight, and I want you to try this. If you put all your weight on those 3 pads and then slowly start to lean forward, just really gradually shifting your weight forward, you can find yourself shifting up. I guarantee you that if you were to just go up on your tippy toes, you would probably lose your balance the first time. But if you do this and you stand and you slowly go forward, you can kind of feel your weight shifting. You can get yourself centered. You're going to go from the base of your neck and pull yourself up into a straight position. And it's like the person who did this on YouTube called it like the perfect posture creator. So you actually stretch your body up. So this is a nice way to get your body elongated and get yourself shifting. This other one is where you put your thumbs up. You can make a fist or just put your hands forward and you're just reaching up over your head. And again, the whole purpose of that is to be able to feel the extension in your upper back, because a lot of times we tend to be rounded over and those muscles don't get worked enough. But if you reach up and then take in 3 really deep breaths and hold. So you take in a breath and hold, keep up there, take another breath and hold. Then if you really want to get complicated, what you can do is, let me see if it's going. Oh, I can't make it go any forward. Oh, well. But the other one is where you reach up and then you go back and then you come forward. So this is the one, if you're really good, you can actually go down into squat, stretch out, pull back those triceps, stretch out the front of your chest muscles, the pecs, and then you go up on your toes. So this is really good to stretch out your muscles, as well as to try to create control and practice in keeping and maintaining your center of gravity. Okay. So remember that everything always needs to be in alignment. And if for some of you in your low back, everybody's a little bit different. Some have an excessive curve in the low back and some have a flat back. So depending on what you have, you're going to either have to contract your abdominal muscles to flatten out your back if there's too much of a curve, or if you don't have much of a curve, it could mean that your butt is kind of tucked under. We call that a posterior pelvic tilt. And we may ask you to actually try to stick your butt out and create an arch in your low back. So again, you got to look at your own posture and see what it is that you need to do to try to correct it. So I know that I went through a lot of information. You probably aren't going to remember all of it. I'll see if I can put together a handout thing that maybe Debbie can send out to you. But one of the things that I found online, again, through this organization called Foundational Training, is this process called decompression breathing. So decompression breathing can assist with spinal alignment and improving posture. It also strengthens your core muscles, and the core muscles include both the front and the back muscles. And you can see there are a lot of them, the latissimus dorsi, rhomboid, trapezius, levator, scapula on the back. And then you have the front muscles, which are the pecs, the rectus, transverse, abdominis, obliques, and the diaphragm. So what you're going to do, and I'm going to talk you through this. So basically, when you're standing, what he's trying to say, and sorry, we were trying to get the sound to work and it just wasn't, we tried some different things and I couldn't get my notes to stay off. But basically, here is what you're going to be doing is you're going to be getting your feet into almost a parallel position. Remember to keep your knees loose. He talks about getting into a shaka sign. And in that shaka sign, your thumb is going to be on the lower rib, and your pinky is going to be on the top of your hip, on the ASIS, the anterior superior iliac crest. And you can do this sitting down. So if you sit with your feet flat on the ground, pull yourself up and put your fingers on the rib, your thumb on the lower rib, and your pinky on the top of your hip. And then what you're going to do is you're going to throw your chest out. Okay. And then what he's going to be doing is he's going to be starting to take some deep breaths. You're going to see him, and they're even calling it a shaka sign. Oh, shucks. You know what? So I'm just going to show you the picture. So as you see him there, what basically he does is he takes in some deep breaths. As he takes in those deep breaths, he fills out his chest and holds it up high. As he exhales, he keeps the chest up high. He doesn't let it go. And so basically you're opening up the chest cavity. It increases space for the organs to function. It decompresses the spine. You go from the base of your neck again, and you pull it up towards the ceiling, kind of like, you know, ballerinas that pull their heads up as if there's a string on the top of their head. And then you breathe. So you want to hold it and you breathe. And when you breathe, it's actually opposite of abdominal breathing. So in abdominal breathing, you know how they tell you to push your stomach out? This is the exact opposite. You want to actually push your stomach in. So you take your belly button and you try to push it back towards your spine while keeping your chest elevated. So you have to kind of, it's almost, you feel like you're doing a shallow breathing, but in reality, you're actually being able to open up the space for the lungs to actually enlarge. So it actually helps with breathing if you can get used to this movement. If you do this several times a day, it will help you with your posture. What I notice is that when I do it and you take in a deep breath and you hold it, and then again, you breathe out by pushing your belly button in to exhale. Now just remember to depress those shoulders. You see his shoulders are down. So you remember we talked about shoulder depression. Remember to keep them down and back. Keep the chin back, chest out, taking another deep breath. And again, hold it up there. Push that air out through your belly button. Keep those shoulders down, taking another deep breath. And if you keep trying to hold there, you can feel all of your core muscles working. It's hard to maintain. Those are muscles that you need to be engaged all day long to help support your spine, to help give you stability in everything that you do. But just the fact that it's getting tired just by breathing and holding is an indication that those muscles are weak and could actually really benefit from this type of breathing. Okay, so that's a good way for you to be able to get into alignment without having to think of the shoulders, the hips, the knees, the ankles. I still want you to recognize what your asymmetries are, because when you're sitting, you need to know whether you're leaning over to one side, or when you're standing on one leg or shifting your weight. Those are all important things for you to know. But at least throughout the day, just to get your spine aligned, you can do this decompression breathing. And I have a link that I'll also send to Debbie that she can send out to you. And you can actually watch the video that they go through and take you through the whole thing. Okay, so this next session is going to be on simple exercises you can do around your home to improve your strength, flexibility, and balance. So this is me doing this yesterday and trying to edit it last night. So what I'm trying to demonstrate here is a sit to stand, okay? So this is what we teach everyone when we're first trying to teach them how to do a squat. We do a sit to stand. We use this technique so that we can teach them the proper technique for the squat. And most times what we find is that people just don't do a squat correctly. This way, you don't have to worry about somebody kind of falling or losing their balance. What you're trying to do is you start them in a standing position. You bring their arms forward so that they've got some leverage in front of them. And then what you're going to do is you're going to start by pushing back at the hips. So the hips have to initiate the movement. It doesn't happen at the knees. The hips go back first, and then you let the body follow, and then the knees will follow. When you're standing up, you're again going down and leaning forward. So you can kind of see, let me do this again. You can kind of see that when I go to stand up, I'm going to stop it right there. I wish I could stop the video in between, but it doesn't let me. So I don't have to lean that far forward going down, and that's good. I want to keep the weight on my heels. But you see, as I'm going up, how far forward? If you look at my shoulders are actually getting in front of my knees. And if you look up and down through like where my shoulder is here, and then down through my knees and ankles, that's almost a straight line. So that's my center of gravity. That's why when people try to stand up, they keep falling backwards, because they don't want to lean forward. Because you can see if they don't lean far enough forward, their center of gravity is going to be behind them and they're going to fall backwards. So that's why we teach people a functional squat. It's not the real squat where you try to stay upright as possible. Our squat is, we want you to lean forward because it's functional. We want you to be able to get up out of a chair. We want you to be able to stand without falling backwards. Okay. So this next one, okay. Okay, so now we're not going to sit down at all. We're just going to go back down. Again, you see I'm initiating with the hips. If you watch my, oh, where did it go? Where did it go? Hold on. Okay. Oh, I didn't go far enough. Sorry. Okay, so we're teaching you a body weight squat, but this is a typical body weight squat done by someone in fitness, right? So they're keeping their neutral spine. So you see their back muscle here is pretty aligned here. Their butt is up in the air, so it's not tucked under, which we call that a butt wink, when you don't have enough range and your butt winks underneath. So she doesn't have a butt wink. If you look, her knees are only slightly in front of her toes, and that's because you look at her thigh her thigh bone is really long. So in order for her to keep her balance, her knees have to come forward. But for most of us, especially Asian people, we're very short. Our legs are short. So we can keep our knees behind our toes. That's what you want. You want the knees always behind the toes. The weight is going to be focused on the heels, and you want the ears over the shoulders. There's a tendency when you're going down, because you're trying to stay up, lots of times people hyperextend their neck. You want the neck to stay straight. So you see there's a straight line going down this way. Okay, so you're going to start with the neutral spine. You're going to push your hips back, keep the weight on the heels, and then on your way up, you're going to squeeze that butt and then stand up. So this is the example. Hold on, I got to take off my laser pointer. So you're going to push the butt back, and you see I'm leaning way far forward. And that way, I don't feel like I'm going to fall. The weight is on my, I'm practicing keeping the weight on my heels. Okay, so what I was doing there is, after you get good at doing the squats where you can kind of hold yourself down there and you don't fall and sit back down, at the very bottom, what you're going to do is you're going to come down, and then you're going to, just before you feel like you're going to drop, you can't go any lower, you're going to hold that, you're going to squeeze your butt. And then this part is what we do with a lot of our older adults. We ask them to pop up. And the reason for that is because a lot of times it's those quick movements that we lose as we get older. So we want people to have that speed and quickness. And so we try to get people to do it in a safe way. Thing that you want to always keep in mind, again, like I said, is the knees stay behind the toes. You don't want the knees to come forward. You want to stay behind, and then you're going to initiate with that butt again. And then pop up. Okay. Okay, so my advice to you is to do 3 to 5 squats every time you have to get up from a chair. There's a new slogan out there. It's called "Sitting is the new smoking." Obviously, smoking is extremely hazardous to your health, but did you know that sitting for too long is now considered a health hazard? So prolonged sitting actually lowers your metabolism, increases your blood fat and sugar levels. It lowers your good cholesterol, increases your risk for back pain, and studies have also found that exercise does not reduce the harm caused by sitting. So a lot of people say, well, but I exercise 3 times a week, or I exercise 5 times a week. What the studies have shown is that even though you exercise as much as you may think you're doing, if you sit for longer than 30 minutes at a time, all of these harmful things that are happening to your body will continue to happen. Exercise does not reverse them. So my recommendation to you is every 30 minutes, just move. Whether it's doing a few squats, just stretching out, stomping your legs around, doing some standing marches, just move. Okay, another exercise I recommend people doing around the house is, everybody has a laundry jug, right? Laundry soap. This is a farmer's carry. Just grab your bottle of laundry soap, and if you have an empty one, fill it up with water. Put it down. You see how I squatted down? So I stopped at this point in the video because remember how I said that what you want to learn in your exercise or fitness classes is to be able to do things that you can then carry over in your everyday functions. So basically, I want people to be able to squat whenever they have to go down to the ground. So if you have to go down to reach for something, to tie your shoes, to put on your pair of pants, whatever it is, I want you to start to be able to do that in a squat position, which means you're exercising your glutes, you're strengthening your quads, you're engaging all of your balance muscles, because you got to balance if you keep your weight on your heels. All of those things are really good for your body. And if you just start doing this, you're going to be really well prepared for the time when you start to get older and you start to lose some of that muscle strength, because we lose about 1% on average every year after we hit the age of 50. It's a very small amount, but because it's so small, we tend to adapt to it. And when we adapt to it, it's like, oh, you notice it maybe a little, or maybe you even don't. And then one day, all of a sudden, oh, it's a little more difficult to stand up. What happens is then you accommodate to that. You figure, oh, I'm just getting older. You get used to it, and that becomes your new norm. And pretty soon you keep adapting to it until you no longer can do that particular skill. So that's what happens to some people. They think, oh, I'm getting older. They can't get up from a chair. They have to push up now. They used to be able to pop up. Now they have to push up. Next thing you know, even pushing up isn't enough. Now they got to have somebody help them. They got to pull on somebody. So those are the progressions. When you start to see someone first starting to need to push off, that's an indication that they're starting to lose strength. So again, exercises like this, where you're going down in a squat. The reason why I do like the farmer's carry is because in the farmer's carry, you're exercising your oblique muscles. So it's one-sided. So you're exercising the external and internal oblique muscles of the stomach. So those are your core muscles. A lot of times we think of our abdominal muscles as being the rectus. Those are the six packs. Those really don't help you very much in your everyday activities. You need the abdominals. So just get a bottle, walk across, put it down, do your business, pick up a bottle, move. So just take it with you wherever you go, and you'll get a decent amount of exercise from just that. Okay, so balance is a skill. You either use it or lose it. One of the reasons why we work out with people is because so many people have a fear of falling and they become overly cautious. Being overly cautious can prevent you from getting up and moving around. With less mobility, there's going to be more muscle atrophy and lots of loss of strength. What happens is your body gets more rigid because you're afraid to move. So you know how you see people, it's like they walk slowly and their body doesn't move because they're taking such cautious steps. They start to get really rigid. Excuse me. Less practice trying to regain your balance also, or responding quickly, means slower reaction times, which is going to further increase your risk for falls. So as you walk more slowly, you don't have that practice ability of catching yourself to exercise those balance skill muscles. We talked about the core. When you go off balance, that's what you need to do. So that's why we go into the single leg stand with people. So as an example, I'm going to show you here. What we tell people to do is go to a countertop, go to a chair, and just try to pick your foot up. What we want you to be able to do is be able to at least hold your foot up for 10 seconds starting out, and then eventually maybe 30 seconds. If you can't, then keep your toe on the ground and just try to pick your hands up with just your toes on the ground. You gradually, so you saw my kind of fingers came up. So the reason why this is important is you watch. When people lose their balance, you see how your body goes all over the place? All of those core muscles are trying to help you find your center of gravity again. But if it doesn't remember how to get to that center, it's going to keep going all over the place and you're never going to find it. So that's why we have to get people in that unsteady position so they start to figure out, where is my center? How do I get there? Sometimes we actually have to place them in their center. We use a PVC pipe that they hold on to, and we place them to find their center so that they basically have to shift themselves until they know what it feels like and then try to hold it there. So single leg stances are really important. This is something you can do at the counter. Safely, just put your hands up. Again, start with just the toes, then lift a little bit further. Doesn't take a whole lot, but it's really good for you. We also use activator poles. So when people start to lose their balance, these activator poles, you can see there's a little ledge right up here. So under my hand here, there's actually a ledge where my hand sits. So when I actually take a step, I can push down on that ledge. You can walk using that ledge. So for people who are starting to lose their balance, instead of using a walker, which makes you hunch over, you can actually use something like this where you're actually exercising more muscles, because right here, I'm pushing down as I'm lifting my leg up. So I'm feeling my core get engaged. My arms are getting engaged. So you're actually burning more calories, exercising more muscles, and you have a little bit more support, so you can walk more functionally. A lot of times when people start to lose their balance, you start to see that their body starts to contort and they walk in ways that the body doesn't look like it was meant to be walking. And they can't get out of it because they're too weak. What this does, it puts you back up into a neutral position so that you can actually, so that you can actually hold yourself up and walk in a neutral position so that you can start to develop the muscles in the way that they're meant to be used instead of leaning over into a walker or a rollator. So by keeping yourself up, it's the single leg, you can stay upright and engage everything and get into that kind of good position of lifting your leg up with support. Okay, another exercise that we do are wall sits. So what we do in the wall sits, and I have a towel behind my back because with the sun, the white wall, it's all chalky and I was going to get my back all white. So I had to get a towel to make sure that my back didn't get all white. So sorry about that. It looks kind of funny. And then you see my clip up at the top. So I couldn't put my head all the way back because I have a plastic clip there. So just imagine my head is hitting the wall. So in this particular exercise, you want to start with your feet about hip distance apart. You're going to be holding, you don't need to have water bottles or soup cans, but if you have them, or if you have 1 pound weights, it just gives you some feedback and it gives you something to do as you're doing these wall sits. So what you're going to start doing is you're going to start walking yourself forward. And you're going to scoot yourself down. Now you're going to stop right about here. You don't want to get into that 90-degree angle that sometimes people get into. You're going to stay right here. And this is where your knees have to stay behind your toes again. We don't want to put extra pressure on your knees. All of the work is going to be done in your quads and in your butt and your back muscles, holding yourself up. So you're putting that weight down into your heels and keeping the weight off of your knees. If you go down too far and your knees start to ache, push yourself back up a little or walk yourself back a little, okay? So you want to get yourself stabilized. And remember I talked about the position of your low back. So I was pointing to my stomach because some people have a really big curve. Those people, they want to push their backs into the wall to flatten their back and strengthen their abdominal muscles. Me, I don't have a whole lot of a curve. So what I'm going to try to do is I'm going to try to tighten my abdominal muscles, but I'm going to try to keep some of that curve in there because I don't want the curve to get reversed, which I can easily do because that's just my natural posture. So I'm going to try to keep that curve, but tighten down my muscles. The reason I have my hands positioned like this is because, again, I always want my thumbs up if possible. In the thumbs up position, that's like what we were talking about when I asked you to open your hands up and turn your thumbs out. It keeps your shoulders rotated out. So you want that thumbs up position to open up your chest and keep your shoulders rotated externally. And then from here, you can, one more thing. And then your head, remember I said it's supposed to be back. So it's supposed to be in line with my shoulders, but my clip is stopping me. What you want is you want it to go straight back. So you don't want to tilt your head backwards, but you want to do a chin tuck and push your chin back into the wall. Then from here, you put your elbows back into the wall. And remember, we talked about that down and back position. So you're going to pull your shoulders down and back, keep them down and back. And now we're going to do some external rotations. So we're, again, trying to strengthen your ability to keep those shoulders out in neutral by doing external rotation exercises. So you can do like 20 of these. And then the next one that I do are basically bicep curls. So we're going to come down and we'll do some bicep curls. Now, again, I like to do one arm. Stop, sorry. Oh, shucks. Oh, well. So I was doing bicep curls. I do like one arm at a time because with one arm at a time, and I guess this, I didn't do it all. Just got to change. Okay, so you want to do one at a time. And again, you want the asymmetry when you're exercising because that way you can kind of tell when one muscle is weaker or stronger. You can feel it more. And that way you can know that, okay, if one side feels a little bit weaker, you want to exercise that side a little bit more. If one side feels a little tighter, you want to do a little more stretching on that side versus the other side. So again, I know I covered a lot, but the key things that I hope that you walked away with are how important posture and body mechanics are while exercising in your everyday life, not just when you exercise, but how it applies to your everyday life. Because you probably only exercise maybe an hour 3 times a week if you're that good. And the rest of the time you're doing all these other activities. And if your posture mechanics aren't good, then you're not really getting the full benefit of exercises that you're doing. So remember that sitting is hazardous to your health. So you want to get up and move, because we know that regular exercise doesn't mitigate the risk factors of sitting for longer than 30 minutes at a time. You also need to challenge yourself to move. You need to move more quickly in a safe manner, because balance and reaction time are skills. And if you don't use it, you are going to lose it. Remember that if you're lacking flexibility in any of these areas, okay, you're going to, sorry, I've got a tickle in my throat. It's going to be very difficult for you to maintain your posture and ability to move well through all of your different activities. The key areas which often become less flexible, we talked about the decreased ankle dorsiflexion, the tight hip flexors because we're sitting, so our hip flexors get really tight, and tight muscles tend to be weak muscles. Also, because we're in that flex position, that also means that our hip extensors, the gluteus, it's so stretched out. Have you ever heard of the term sleeping glutes? It's so stretched out and we never use it that they forget how to work. So they just sleep most of the time. And then they become weak as well. So the other areas that are affected are shoulder flexion and internal rotation. So that's why we focus on external rotation, raising your arm up over your head in like a shoulder press, but doing single arm at a time. So you can kind of note the difference, whether one arm needs more focus than another. Most of us have weak core muscles. So we want to make sure that you are engaging that core, either through that decompression breathing or when you are doing the wall sits, making sure that you're engaging your core in the position that your back needs to be in. As we get older, we don't, oh, sorry. Yeah, okay, I just want to make sure I covered it. So finding your neutral is really important. You need to know what your ideal neutral, and I say this because some of us may already have some of those changes occurring. So you need to know what your neutral is, and it may not be the way that it's supposed to be, but it's the best way that you can get to so that you don't continue deviating into that asymmetrical positions. You need to also be able to recognize when your body loses its neutral throughout the day. So that's where I mentioned 3 times a day, try to get into that decompression breathing, because that's going to help at least align your spine. Try to make sure that you're pressing your shoulders and keeping your shoulders down and back. Check yourself periodically and make sure that if you know that one arm goes up, that you push that one arm down. Just having the awareness starts to create the changes in your body. And just remember that you do need to move. If you don't move, it kind of defeats the purpose of a lot of things. So hopefully you don't have to keep these positions, but by being more aware and just every once in a while kind of saying, oh yeah, just straighten up. Let's do some breathing, get that spine straight. Oh, I got to push my shoulder down. Oh, I got to stick my butt out a little bit more. I got to flatten my back out. Just by thinking of those things, you're cueing your brain and retraining your brain, because otherwise your brain thinks that what you're in is normal. That's why when you go into a good postural position, it feels abnormal because you trained your brain that this is not normal for you. So we have to retrain our brain to what normal should be. So I hope that it wasn't too much information for you. I know I talk really fast and I try to cram as much as I can in, but hopefully you got something out of it, and I'll get you the handouts. Thank you again for having me today, and feel free to contact me if you have any questions that come up later.